Finasteride seems quite scary when you spend some time in online forums. But is it that bad? Is there something that doctors like me are not telling you that might change your life forever if you start finasteride? I'll share with you my clinical experience as well, having prescribed finasteride to thousands of patients. How soon after starting finasteride do side effects actually develop? They usually develop within a few weeks of starting the medication, but sometimes it can be further out. There are people who are okay for years and then start to notice that, hey, maybe I'm feeling like something is off. But typically these side effects are not subtle. When you develop one of them, you know you have it. Because some people worry that they might be on these medications and there might be some harm that's being done to their bodies, but they might not know about it, and then it might be too late to reverse those issues. But in my practice and what's reported in the literature, that's not typically the case. Usually what happens is that within the first few weeks of taking the medication, you might start to experience that, hey, something feels off. I'm having one of these side effects that we're going to be discussing. Then of course you have to report it to your prescribing physician and make sure they take you off the medication and or adjust your dose. But it has also been shown that most of the time when people develop side effects, if they continue taking the medication, those side effects tend to go away. And that's something that's interesting, and it's been reported and I've seen it in the practice. But usually my approach is to adjust the dose so that people don't have to experience those side effects. What are the most common side effects of finasteride? Well, the most common, as some of you may have heard, are sexual side effects. These include decreased libido, erectile dysfunction, and a reduction in ejaculatory volume. The incidence of these side effects is 2 to 3% on the standard dose of 1 milligram of finasteride daily, taken as a pill. Keep in mind that these side effects were found to be present in about 1% of people in the placebo group of these large clinical trials done on finasteride. So even people getting a water pill in these studies still reported some of these same sexual side effects. And there's a similar incidence of these sexual side effects of patients on finasteride in my practice. So I find that the 2 to 3% incidence holds up in my practice. And that's very different, I think, from what a lot of people believe to be the incidence out in the general public. I would say that in general, people think that the number is much higher, maybe closer to 50% or even higher. But in reality, that number is much, much lower, closer to 2 to 3%. Keep in mind that that incidence of sexual side effects will go up as you try the more potent cousin of finasteride, which is dutasteride. And that incidence generally comes down when we go to lower doses of oral finasteride, like say 0.5 milligram every day or every other day, and especially as we go to the topical formulations of finasteride. Will these sexual side effects go away if I stop taking finasteride? Can they be permanent? Based on the literature, my surgical hair practice, and the experience of many of my colleagues, these side effects generally go away within weeks to months of stopping finasteride. But there are reports online and rare documented cases of post-finasteride syndrome. In other words, permanent side effects. So are doctors lying, or are patients underreporting long-term problems? Or are there other conditions related to reduced sex drive that are masquerading as the fault of finasteride? Other causes of similar sexual issues include smoking, sedentary lifestyle, poor general health, endocrine issues, cardiac problems, circulatory problems, structural issues, psychological problems, and many other potential reasons. It's often difficult even for experts to determine proper etiology, and sometimes it's easier to blame a pill than it is to dig deeper into the underlying cause. There's been no causal relationship statistically established between finasteride and post-finasteride syndrome, but one should not discount the possibility. This is an emotionally charged and controversial topic that surely needs more research. And I think that there are a few things that complicate the analysis, and that includes the limitations of self-reported data and the nocebo effect, which is where people experience symptoms because they expect to. And this issue, of course, highlights the importance of good communication between the provider and the patient. If someone reports a side effect symptom to me, what I often do is take them off the medication and wait for the symptoms to resolve. I then discuss with them the possibility of restarting the medication at a lower dose, one that will hopefully still be effective for helping them preserve their hair, but also one that will minimize their risk of side effects. Sometimes we bring people down to topical finasteride, and we have a video dedicated to topical finasteride. But remember that based on the concentration and the amount applied of the topical finasteride, you might be driving your DHT serum levels below what you would see with just standard dose oral finasteride. Now let's talk about some of the non-sexual side effects of finasteride. The first is breast tenderness or enlargement called gynecomastia. This is seen in about 0.4% of patients on the medication. And this percentage is actually the same as what was seen in the control groups of the studies on finasteride. Another potential side effect that you may have heard of is male breast cancer. But in 29,000 men studied on 5 milligrams of finasteride, 5 people in the finasteride group developed breast cancer, whereas 3 people developed it in the placebo group. And in another study of 17,000 dutasteride patients, 2 people developed male breast cancer in the dutasteride group compared to 1 person in the placebo group. So that incidence between the medication arm and the placebo arm is fairly comparable when you consider the size of these studies. Prostate cancer. Remember that finasteride and dutasteride reduce the volume of the prostate and have been studied extensively in very large trials. It was initially found that finasteride reduced prostate cancer risk for low and medium grade cancers, but increased the risk for high grade prostate cancer. Later, those initial observations were reanalyzed and were found to be inaccurate based on a study published in the New England Journal of Medicine. We've linked to that study in the description below, so make sure to check it out if you're interested. Early concerns regarding an association between finasteride and an increased risk of high-grade prostate cancer have not been borne out in large trials. It was actually found that finasteride was leading to earlier detection of prostate cancer, and that in turn made it look like the incidence of prostate cancer in the high-risk category was higher in the finasteride group. But keep in mind that finasteride does decrease PSA in men by about 50%. So let your urologist or primary care physician know if you're on finasteride and you're being screened for enlarged prostate or potentially even prostate cancer. Psychological issues. Depression and brain fog have been reported, though they're not common. But I think you need to be careful with finasteride if these pre-existing conditions are present. Testicular pain. A patient of mine is actually not able to tolerate finasteride because he has another condition called varicose veins, and the enlargement of the veins in the testes can give you testicular pain, and when you couple that with finasteride, which could also potentially cause testicular pain, it could be difficult to determine the primary culprit of the pain. And so this patient of mine, his urologist has instructed him to not take any type of finasteride. It's also possible to get an allergic reaction from finasteride, though again, that's very rare. That could present with itching or hives. It can also present as facial swelling. Remember that finasteride is metabolized by the liver, so in patients who have known liver problems, it's very important to be careful with the administration of finasteride. Finasteride and dutasteride are not for pregnant women, and that's due to the risk of developmental abnormalities in a male fetus. Men are advised to stop taking finasteride for about 2 to 3 months prior to trying to conceive. Typically, this is not a long enough time period to start to experience appreciable hair loss. And men need to be particularly careful with the exposure to pregnant women of topical finasteride and cut-up tablets of finasteride. Both of those scenarios increase the risk of exposure to pregnant women. So while many people are switching over to topical finasteride, this is one of those risks that needs to be kept in mind. Patients taking finasteride should not donate blood, as this blood may potentially be given to a pregnant woman. Despite this cautionary tale, more than 90% of my patients are on finasteride and thriving, and not just for a few years, sometimes for decades. If side effects occur, we take them off the medication and then we dose adjust. And I would argue that in many cases, finasteride is more critical than a hair transplant at overall hair aesthetics. It's usually better to preserve good hair than it is to chase it later with numerous hair transplants to try to recreate what you once had. But monitoring one's health while on finasteride is very important. But do not make decisions based on fear alone. If I haven't completely scared you and you're considering trying finasteride to prevent further hair loss, you can get it cheaply and easily at feelconfident.com. Or you can get it through my practice for even more personalized attention in trying to achieve your hair goals.